When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite. Obey your thirst.
This episode is brought to you by Indeed. You're ready to move your business forward, but first, you need to find the right team. Start your search with Indeed Sponsored Jobs. It can help you reach qualified candidates fast, ensuring your listing is the first one they see. According to Indeed data, sponsored jobs are 90% more likely to report a hire than non-sponsored jobs. See the results for yourself. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Hi, and welcome to the Med Prep to Go USMLE Step 2 podcast. I'm Dr. Raj. I'm super pumped up, and I am a quadruple board certified doctor in pulmonary, critical care, internal medicine, and sleep medicine. I've been teaching USMLE and IM board review and subspecialty board review for a super duper long time, like almost 20 years. And I'm so excited to be part of the Med Prep to Go team. Our mission statement is to improve medical student wellness and reduce educational debt by providing high quality USMLE questions in an online and audio format. Also, by making medical education and material available to study on the go. We at Med Prep to Go strive to give you time back in your day to focus on your health and well-being. So what is the routine? We're going to go over 3 questions that are going to be superstar high yield for USMLE Step 2. You also could go to our website, once again, medprep2go.com, and you could read the questions and look at the answers too. So today, I'm going to tell you, everyone thinks my favorite thing to talk about is always going to be the lungs, but it's not. In fact, I love, with a big L, rheumatology. It's a dark horse for USMLE Step 2. And if I didn't mention, I have a wonderful, smart, intelligent, beautiful wife who is a rheumatologist. So I think I'm learning by osmosis. So the more I give her a big hug, the more rheum knowledge comes my way. So here's the 3 questions we're going over. Question number 1, literally question number 1. We have a 50-year-old woman presents with constant left hip pain with associated dull ache and throbbing groin pain. She has a past medical history of lupus, hypertension, chronic kidney disease. Her SLE is difficult to control. She has been on prednisone, 20 milligrams daily for more than a year. Stop right there. That is horrible. I feel so bad because, prednisone, sure, is kind of our friend. It has anti-inflammatory. It works quickly, but it's totally our enemy. If you're on it for a long time, you can't taper it off. And what are going to be those side effects of being on long-term prednisone? Well, is it going to be the weight gain, the diabetes, the hypertension, glaucoma, cataracts, osteoporosis, osteopenia, susceptible to infections? I can go all day. So I'm already predicting something bad is happening to this 50-year-old on 20 milligrams of prednisone for more than a year. She's also on hydroxychloroquine. Stop right there. So when we talk about medications for SLE that do have data that shows that it may actually improve survival, it is hydroxychloroquine. It shows that when you get flares of SLE, it may not be as bad if you're on hydroxychloroquine. And also it may actually reduce flares at the same time. So they won't, not only will they not be as bad, you get less amount of them. So sure, you should always clinically ask if your patient will be a good candidate for hydroxychloroquine when they see their rheumatologist. So back to the question. She claims the pain started spontaneously about a week ago and has gradually worsened. The pain is worse when walking and weight bearing. She walks with a limp and has marked discomfort and limited range of motion on the left side. Which of the following imaging modalities is diagnostic of the patient's condition? Okay. What is she doing? She's walking with a limp, has a lot of discomfort, limited range of motion of the left side. Okay. And this is going to be a throbbing groin pain. All right. So do you want to get a pelvic ultrasound, which is A, B, a bone scan, C, an MRI of the left hip, D, a plain radiography of the entire pelvis, E, a plain radiography of the left hip? So let's kind of go through these answers together. And the correct answer is going to be C, get that MRI. So what do we worry about in this patient, especially with all those steroids, osteonecrosis of the left hip? Therefore, of the choices here that are listed, MRI would be the best imaging modality in this case. Patient has been treated with prednisone for years, and we know that prednisone is associated with osteonecrosis. Choice A is wrong because pelvic ultrasound has no role in the diagnosis of osteonecrosis. So that would not be the right answer. B is incorrect. Doing a bone scan is not going to be useful in patients such as this. MRI is definitely going to be far more sensitive in making the diagnosis earlier. And D and E are incorrect because we're just talking about x-rays, plain films. They have poor sensitivity for detecting early disease and definitely are not diagnostic of osteonecrosis. So of the choices here, what would be the right answer? C, MRI. Let's do another one. Next question is a 53-year-old woman with no known medical history presents to her primary care physician's office to establish care. The patient reports she has not seen a doctor since her teenage years because hospitals make her nervous. She reports experiencing intermittent chest pain that is exacerbated by exertion and is alleviated by rest. She reports her mother died at age of an MI, myocardial infarction, at age 74, and her father is receiving dialysis for renal failure. She also mentions both of her hands have been very stiff in the morning for a couple of hours. So that's some morning stiffness, which improves as the day goes on. And she has been somewhat fatigued. She has been taking over-the-counter ibuprofen daily for pain and discomfort. Otherwise, she denies any hair loss, headaches, oral ulcers, dyspnea, abdominal pain, any rash, no obvious joint swelling or fever. They did an ECG in the office, which shows no significant ST or T weight changes, and they are scheduling her for a stress test done at a different day. Which is the next best immediate step in the management of this patient? So we got a 53-year-old woman came to establish care, and she's having morning stiffness, and it seems to be bilateral nature, implying that it's probably going to be inflammatory. So is the next step ordering a troponin as an outpatient? Is it B, bilateral hand x-rays? Is it C, order an ANA? Is it D, discontinue ibuprofen? Or E, refer to physical therapy? Now, this is a little tricky one. So number one, they're not giving you enough info to help slam dunk the diagnosis. But, judging from the question, I think they're trying to pick what is a chronic symmetrical inflammatory arthritis. And what are going to be the big three? It's always going to be rheumatoid arthritis, SLE, or Sjogren's. Yeah, I didn't make a mistake. Sjogren's. Sjogren's is not just a disease of, oh my God, my eyes are dry and my mouth is dry. I mean, you could have extra glandular Sjogren's that could affect almost every part of the body, including giving you a symmetrical arthritis. But judging from the fact that the writer put down no hair loss, no rashes, I mean, definitely they're trying to tell you this is not going to be lupus in the question. But once again, give me some labs. Where am I? Give me some labs. But, with that being said, I think they're trying to imply this is rheumatoid arthritis, though it's not been diagnosed yet. So with that being said, I don't like choice A, order troponins. I mean, patient's not actively having chest pain, so I don't know why I would suddenly start ordering troponins, especially in an outpatient setting. So A doesn't make any sense to me. Choice B, bilateral hand x-rays. You know what? I like that. When someone comes in and you are worried about inflammatory arthritis or even an OA, I mean, it's an x-ray. What's the big deal? Get the x-ray. And it's important when we talk about RA because you really are looking for one thing. Is there going to be any type of necrosis? So when you see anything that says that there's something necrotizing or destructive in the joint, well, hey, you want to be aggressive. What do I mean by that? Those are people you don't want to just put on, hey, here's some Tylenol or a non-steroidal. I mean, you may want to use DMARDs in these patients if they have, something like a rheumatoid arthritis. So I don't know, but I do like choice B quite a bit. Choice C, ANA, not a bad idea. It really depends where you're going with this. I mean, these rheumatological disorders are not easy to diagnose. It's not just one physical finding or one lab. There are very extensive criteria. If you want to get an ANA, I wouldn't say that's going to be a wrong choice. So, judging from me doing a lot of questions, I can see from here they're really trying to skew away from lupus. So, sure, I'm not going to order C DNA, but in real life, someone's going to order DNA. So, choice D, discontinue ibuprofen. Well, I would say this. I see where they're going with this. The patient has some chest pain and possibly could be rheumatoid arthritis. And people with RA are definitely predisposed to a lot of coronary artery disease. So definitely at a higher risk. And you want to avoid, ibuprofen. But once again, it's not a wrong answer. It's something that can be done as the next best step in management. It's like, hey, hold on with the ibuprofen until I get some labs. How are your kidney function doing? Establish the diagnosis. So it could be the right answer. Or E, refer to physical therapy. I mean, never wrong to go to physical therapy, but I wouldn't say it's the next immediate best step. So doing some test taking skills, I would say I am torn between bilateral hand x-rays. That's not wrong to help establish the diagnosis going forward. I'm definitely not wrong. You're not a bad person from ordering an ANA, but I'll take that one off. Or it could be D, stop the ibuprofen first because that's the immediate next step. And of course, with these risk factors, and it turns out to be RA. So let's see what the answer is here. All right, it is they went for D for the exact same reason, which is discontinue the ibuprofen. I mean, people with RA, if this is the diagnosis, are going to be at a high risk. You know what I mean? For having a myocardial infarction. And these drugs in people with coronary disease definitely puts him even at a higher risk. So I think this is great. I really, really walk through here. And like I said, I love the bilateral x-rays of the involved joints, looking for erosions and destruction. And like I said, sometimes you can be fueled by lupus sometimes. If I wanted to work up rheumatoid arthritis, definitely antibodies like a rheumatoid factor and an anti-CCP. All right, good question. So, man, I'm getting into this. So I think I promised you one more to come in groups of threes.
In Walmart Sue time was ticking away. Only a few nights left till the big holiday. But last-minute gifters had no need to worry. Walmart Express Delivery got their gifts in a hurry. From Nintendo to Nespresso and Lego flowers, they could check off their lists in as fast as an hour. All of Newville, East, West, South, and North could order gifts up until 5 p.m. on December 24th. So this holiday, just do as the Who's do. With gift delivery this fast, they all gasped. From Walmart? Who knew? Subject to availability, terms and fees apply.
Oh, Hilton stay. Your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, a holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
A 28-year-old man with no significant past medical history presents to his primary care physician complaining of intermittent low back pain for the past 4 months. He says the low back pain is worse in the morning, along with stiffness lasting approximately 1 hour, which improves as the day goes on. On physical exam, performing a forward bending test shows no unevenness in the spine and ribs, but spinal flexion is moderately limited. Straight leg raise test is negative bilaterally. Sensation is intact in the bilateral legs and with no numbness or tingling. The patient denies recent fever, weight loss, waking up at night due to pain, urinary retention, or bowel incontinence. He also denies any other symptoms currently. Initial x-rays of the lower spine and pelvis show no obvious, should I say, evidence of obvious spinal changes or sacral iliitis. So initial x-rays show no sacral iliitis. Okay. Well, which of the following is the most appropriate next step in the management of this patient? Is it going to be A, order an antihistone antibody? So what is the buzzwords here? We have young, 28-year-old is super young with back pain. So when we talk about the back, we always worry about something like a spondyloarthropathy. And what spondyloarthropathy do we worry about? Of course, ankylosing spondylitis. And do I order an antihistone antibody? Choice A for ankylosing spondylitis? The answer is no. When do I get an antihistone antibody? Is when I'm thinking about drug-induced lupus. For your board exams, always think about hydralazine, procainamide, INH. And of course, it's rheum. They can be tricky. You could have drug-induced lupus and be antihistone negative. But this presentation does not scream antihistone. So I'm not going to go with A. What about B? Ordering an ESR and a CRP? Interesting. So they already got an X-ray that was negative. I mean, I am tempted to get an MRI, you know what I mean? But I wouldn't get an MRI. But, an ESR and CRP, they are a nice sensitive test, you know what I mean? If they're elevated, you definitely doesn't slam dunk the diagnosis, but if they're negative, so if they're positive, it doesn't slam dunk the diagnosis. But if it's negative, yeah, I mean, that would be pretty nice. When these sensitive tests are negative, that I think they're going to be helpful. So I'm not against B, ESR, and CRP. C, order MRI, but it says spine. I don't know if I would go spine. I mean, if you're thinking of ankylosing spondylitis, you definitely want to look at the SI joint. So I might have chose MRI if it's an SI joint. I'm not really looking for the spine. You know what I mean? All right. Order a rheumatoid factor, anti-CCP. In real life, folks, it's possible, that some of these seronegative spondyloarthropathies, can sometimes, mimic, some of the classic things like rheumatoid arthritis, but it really is a spondylo. So I'm not going to order, a rheumatoid factor or an anti-CCP. If you did, they'd probably be negative. That's what they're called, seronegative spondyloarthropathies. So I'm not thinking D. E, refer to physical therapy. Well, that's not wrong in someone who has an established diagnosis of ankylosing spondylitis. Going to physical therapy is very, very, very important. But I really feel you want to make the diagnosis first. We haven't established that. So of the choices, what, jumps out at me, I think I'm kind of bullied into ordering B. Hopefully, if these tests are, if they're negative, they're normal, it's probably not going to be an inflammatory spondyloarthropathy. I would have ordered MRI if it was of the SI joint, but it just said spine. So I think I'm kind of bullied into picking B. And the right answer is, let me hear it. Let me hit the view answer. See, I do them real time. So I give you my thought process. So hopefully that helps out. And the right answer here is B. Okay, for the exact same reasons that I talked about. So hopefully this is going to be helpful for everyone. I really enjoyed reading these questions. Please check out our website, medprep2go.com, and I look forward to reading and teaching more high-yield USMLE Step 2 questions next time.
Two kinds of phishing out here. One for fish, one for your data. Hackers try to hook you, but Cisco Duo keeps every user and device protected. Cisco Duo. Phishing season is over. Learn more at duo.com.